Hey,
Hi, Hannah.
here we are. Hi, Dr. Ojo-Carons.
I don't know. I
There,
always say your name like that. Hi, Hannah.
I like it. There was a bit of a pause there, so it felt like a drum roll.
hmm How you doing?
I'm good. How are you doing?
Good. I am great. I am so great today. Today's been a good day.
Oh, I'm glad to hear it.
hmm
We are here tonight to talk about Pellevé, but I advertised it as Pelleferm. What is Pellevé?
hmm Yeah, we use the Pellevé machine, but the procedure is Pelleferm. We're firming with it, and so that's why it's named that.
Yeah, so I don't know a lot about it. So I'm excited for you to tell me and the listeners more about it.
Well, you can use the Pellevé machine for Pelleferm, but you can use it for many other things too. And so we do that. We use it for many other things. And really, what it's meant to do is firm the skin by creating collagen and just increase in tensile strength of skin. It helps to reduce wrinkles, helps to reduce cellulite. But my favorite place to use it is the vulva because it helps to firm your outer vagina. And there's nothing that a woman does not need more than loose vagina.
I didn't even think of it for that. I'm so glad that we're having this conversation. I just wasn't even thinking about it for that purpose.
Yeah, I mean, if you really think about it, a loose vagina, what does that cause besides unattractive skin in that area? Yeah, okay, so that's one reason to use the Pellevé. Or radio frequency, if we want to say correctly what type of energy we're using. What does it cause? It can cause discomfort with clothes wearing, your skin catching your clothes. It can cause incontinence if you think about just a loose vagina, what other structures are around there, decreased satisfaction with sex, increased pressure just because of the drooping and the sagging. And so using this type of heat energy to do therapeutic sessions can help to increase elasticity, decrease laxity of the skin and surrounding structures. And then also for other areas like the abdomen or the thighs or the buttocks can help to decrease the appearance of cellulite, which is a good thing.
Okay. So we are going to be talking next week about Diva, which is internal.
Mm-hmm.
So you're saying this can be also in complement. Am I understanding that correctly?
The way we use it is as in complement, you're right, for the outer vagina. But, this type of energy, this type of heat energy can be used also internally too, to do what we're just talking about, increase the strength and decrease the laxity of the vaginal mucosa and vaginal tissues by going right back to it, increasing collagen production. So just making the canal that much firmer and tighter.
So what is the treatment to drink from this fountain of youth?
What's the treatment, or what's the gist?
Like how long does it take per session? How many sessions?
Oh, very quick. The wonderful thing about this procedure and using this type of therapy is that there's little to no downtime. I mean, you can literally leave your office on your lunch break, pop over, get a session done, and then go back to work or go to the gym. Or if you're coming to see me at 5 o'clock, go to happy hour afterwards, so there's no downtime after the procedure. And the procedure is just that minutes at a time, depending on how big the area you want to treat is. It's just minutes.
Okay. And is it painful?
Pain-free. So just the opposite. Mm-hmm. You feel really kind of a warming sensation. I feel like the word radio frequency can be scary, but really when you think about it, it's really just a warming sensation that you feel. So most people that have these procedures done oftentimes say that they feel relaxed. I mean, who doesn't want to feel warm? Who doesn't want to feel warm?
Except for baby today, but yeah, usually.
It's a little hot today.
Yeah. But I mean, still warm is probably cooler than hot.
Yeah.
And so how much of a difference do you see? I mean, how many sessions do you need? Is it person to person? It just kind of depends on the area and the person, or?
Well, depends on the area. So for larger areas, more sessions. You know, the more sessions you have, the more you have for that collagen production to occur. And so abdomen, buttocks, thighs can be about 5 sessions with about yearly upkeep, 3 sessions, so it's fewer. You can see results immediately. It always shocks me how immediate the results are and how different the area looks. But this therapy, even though in our practice we kind of confine it to these areas because I like to stay in my wheelhouse, these therapies can be used in many other areas of the body and have been used for years in many other areas of the body to help do the same thing, increase collagen production, tightening and firming of the skin.
Mm-hmm. And I just want to say that there is nothing wrong with anybody's bodies in terms of if they're having sagging or wrinkling or cellulite. But for people who that bothers, to have that resolved would be this huge alleviation of something that people might be self-conscious about. So I guess just depending on the woman.
And exactly. I think to your point also, for those not only who it bothers them aesthetically, who it bothers them functionally, because there can be a functional issue too, you know? And so you're right. We always take the approach of understanding everyone is beautiful. And that's not just beauty in your own way. Everyone is just beautiful, period. But also, we should have the right to want to pamper ourselves. We should have the right to want to improve body areas as we see fit. You know, I had a wonderful day today because I went to the doctor. I had my own annual check, and then I decided to come home because I had 30 minutes to work out. And so I was doing my workouts, and on the side of my legs, I saw a little area that I thought, I think I'm going to get that worked on a little bit just because I have a little dimpling there. You know, getting older, there's nothing wrong with it, but it's okay for me to want that. And it's okay for me to seek it out too.
In a way, it's no different from exercising. You're keeping yourself functioning and healthy, and there are some, vanity benefits that come along with that as well. But there are definitely some functional ones.
Yeah, definitely some functional ones. And, I think it is okay to it is okay to want to look better. It is okay to want to feel better. And even if it's more is helping you feel better, then that helps you have a different approach to just your daily your daily life and outlook on life.
Mm-hmm. I've got a child swarming me right now.
I see
in all of those areas. Not right now.
And so the Pellevé will help get the skin similar to the one he has, because his skin is chock full of collagen.
I know, and he's found every little area that's slightly saggy, and he's pulling on it.
Yeah.
So what questions do you get asked? What have I missed that patients are asking about?
Well, I get asked about irritation. Well, you have irritation after the procedure. I mean, like I said, it's nice and warm, but irritation and pain after the procedure is also not minimal, but just not there. The whole procedure is really easily tolerated. Mm-hmm. How often should you get it? About every 4 to 6 weeks. In between is great. Gives you time to also really appreciate the difference that occurs. Like I said, for most areas, it is pretty instantaneous that you do see a difference. Is it for everyone? No, definitely will say that. This is for mild to moderate conditions of sagging and wrinkling or cellulite. So, it's not necessarily for everyone, but I think with appropriate use, a wonderful candidate, and also thorough discussion about it, it really can work well.
Mm-hmm. And I'm just going to drop the number for EvoScient right below. So if anybody needs that number or they need to see the website so that they can go get in touch with their appointment, I just want to drop that right there. All right. Great. Well, this is all very exciting that this is right here. EvoScient is located near town center, so really centrally located for a lot of people who are in that area passing through. And I love that it can be something quick that you can do. You mentioned even, on a lunch break or something like that.
Yeah, on a lunch break, on right before you go home from work, or just have the day out for yourself and pop in for a quick session. And again, this is a wonderful adjunct treatment to what we were talking about. What we'll talk about next week, which is Diva. So again, we use this really for the outside, for sagging and drooping of the vulva, along with inner thighs and buttocks and abdomen. But the Diva specifically for inside the vagina. And so, along with use of the Pellevé, you can have wonderful results that will just make you feel even better and have better functioning. And so next week we'll talk a bit more about that.
So full disclosure, we've recorded in advance the Diva. So if you are watching these lives and then you go and ask a question during next week's session, we won't see that question until afterwards. So we will answer it. If you have a question, you can always send it to us through direct message, or you could feel free to drop it there if you're not craving anonymity. But I'm very excited for you to see that one because we've got a really honest, straight up testimony in it. And I think that you should mark your calendar. So can people do both in one? Can they schedule them for one appointment?
You can have both. And it also depends on the person. There's nothing wrong with separating them too. And obviously, there are times that you shouldn't get either procedure done. If you are on your period or you have an active infection, those are times that you would want to avoid any type of procedure. That's for anything really. But yeah, you can get them together. You can get them separate. It's really up to the person.
Okay. And is there a consult appointment first, or can they just call and make the appointment?
Definitely. If you're using doing any type of procedure on the vulva, you have to have someone done a thorough exam before, whether that is another physician, whether that is if you're a patient of mine. There should be an exam first because you need to make sure that the area that's being treated is healthy. That the tissue is healthy and the skin is healthy. And so I do like to do a consultation because at that point we can also talk about what likely outcomes will be and if it's an appropriate procedure to have done. Again, it's not for everyone, but most people do receive benefit from it. So yeah.
Is there anything, even a word or two, that is the thing that brings you the most joy about this offering that EvoScient has now?
I would say the thing that brings me the most joy about offering these services is that they're usually offered, period, in this type of setting. And, it's sometimes hard to be honest with yourself and say the things that you want and the things that you need. And so to be able to offer it in such an intimate setting, I think it makes it easier for patients to access and to also accept. So that's the one thing I'm really excited about, being able to offer it.
Great. Anything I miss?
No, I don't think so.
Cool.
But I think it'd be nice for you to be one of our clients and see how you like it, and maybe you can do a testimonial after.
I will be your guinea pig for whatever. If you were passing me the goblet from the fountain of youth, far be it from me to say no.
Well, maybe next time then you can talk about how your experience.
Yes, I definitely will. Well, thanks everyone for joining us tonight. I hope you have a great rest of the week and something cool and refreshing.
Yes. Good night. See you next week.